Career Max, and today Kian and I will be interviewing Dr. Fatima Bahadi.
Dr. Vahidi is an internist with 38 years of experience in her field. She currently works at Ibn Sina Medical Center in Abu Dhabi. Ibn Sina is amongst the oldest private facilities in Abu Dhabi and has numerous skilled professionals at its two branches.
Okay, Dr. Fatima, could you please expand on your role and responsibilities as an internal medicine doctor? We would love to
Yeah,
learn what a day
hi,
in the life of Dr. Fatima would be like.
Aditya and Kyan. Thank you very much for inviting me to Career Max.
Thank you for coming.
Um, no, thank you. So, as an internist, my role is to diagnose, treat, and manage complex medical conditions in adult patients. So, as far as my day goes, I prefer an early start. An early start with prayer and meditation, actually. So, if they're inpatients, then there are ward rounds, we review patients, adjust management, and order tests, etc. These days, I primarily run an outpatient practice. So I like to get in early to review results and to look at the charts before the rest of my staff comes in. So we get a varied pathology: thyroid disease, high blood pressure, heart disease, diabetes, etc. Beyond direct patient care, I collaborate with other subspecialties, nurses, pharmacists, etc., for a more holistic approach. So we try to deliver what is called TQM, or total quality management, a necessary part of which is constant improvement. So as we go along, we try to improve the service. Teaching and mentoring younger colleagues is also quite important, and I emphasize on it a fair bit. Keeping up with new research is vital. So, for years, I've made myself a promise. I try to read something new every day. So, in short, every day is different, but what remains constant is the responsibility to improve patient care and their quality of life. So, I hope that answers your first question.
Amazing. That was
Thank you.
perfect. That was perfect.
To introduce our next question, like many roles in medicine, I can imagine that the work life balance is weighted more towards work than life. Would you help a young person understand and navigate the balance as well as explain what excites you and brings you back to work every day? Is there anything that drives you away?
Of course, Kyan, medicine is demanding. Invariably, work takes precedence over personal life. For young people entering the field, I'm being brutally honest, they must be ready to work very hard and put the patient's needs before their own. For young doctors, we've all been through the mill. There really isn't much time to spare except to eat and sleep. But let me reassure you that it gets better after some years, maybe 10 years or 7 years, but there is light at the end of the tunnel. But there is great pleasure in a job well done. And especially when it involves patients and their recovery, it's hugely rewarding. What makes me grateful every day is being in a position to make a difference. Sometimes it's a tiny little bit, sometimes it's a little bit more, but it's a huge privilege to have all your life. Seeing a patient recover or being able to provide reassurance in a moment of fear or panic or vulnerability pulls me back to it each time. So, on the flip side, there's administrative burden and occasionally the pressure of seeing patients quickly. If you're running late, or if the list for some reason has expanded. So, rushing through patients in limited time can be frustrating. But the key is resilience and remembering why you started on this journey in the first place. So, that is always reassuring.
Amazing. Amazing.
Amazing.
Yeah, as you say, it is a tough industry, but you get to help people along the way. And I think what draws a lot of people to being a doctor as well. So
Yes,
that's
it
true.
does. Yeah.
And as for our next question, this is one I'm really interested in. So, as a doctor, you must see many patients, but what is the key to maintaining a healthy patient-doctor relationship?
So, it's not an easy question really that you're asking, but I think there are two things that are vital. One is trust, and one is good communication. That is the foundation of a healthy patient doctor relationship. Patients need to be heard, respected, and understood. So, in my practice, I make it a priority to listen carefully, explain conditions in simple terms, and involve patients in decisions. Sometimes there are attendants or family members that try to confuse the issue. Everyone has read everything up on the internet before coming, but Dr. Google doesn't know it all. One has to listen carefully. That's the thing. Um, and talk to them, not talk at them. And empathy goes a long way. Acknowledging their concerns and treating them as individuals rather than cases or numbers is very important. I mean, they're people with a life, right, who've fallen
Yeah,
ill
yeah,
and they have to be
Mm,
treated with respect. So I
exactly,
think
exactly.
that's what
okay.
I would like to do.
Yeah. Thank you.
Perfect.
For our next question, in order for a young person to better understand career paths and options, would you share your educational journey and career history that culminated in your current position?
Kian, it's a long journey
Hmm.
always in medicine. There are no shortcuts. We have to pay our dues, if you like. So my journey began at med school or even before when I was pre-med. Um, in med school, one of my teachers was an inspiration. He had great clarity of mind. So I developed very quickly a strong interest in adult medicine and the complexity of multi system illnesses. So after completing my foundation years, I chose to specialize in internal medicine, which meant years of training and exams and, staying awake all night for many nights, working over the weekend, being on call for long, long hours. But that gives you confidence in yourself because you learn that the human mind and body can both be pushed. So all that hard work gave me a well-rounded perspective, and today I balance clinical work with teaching and mentoring. But each step along the way, um, is reinforced by the importance of continuous learning and staying passionate about patient care. Because you may see the same patient, or rather the same illness, many, many times, but there's always either a new angle to it or you have to look at it with fresh eyes. But even the simplest of things need to be dealt with carefully.
Yes, yes.
So,
Amazing.
that's how I tend to work.
Yeah, thank you.
Very interesting. Very interesting. I think we have time for about one more question. So, could you elaborate on when mentoring or recruiting future medical professionals or healthcare leaders, what
Yeah.
qualities are you looking for in a person?
With every doctor, it varies if they hire staff or, if they're looking to train young physicians. The quality I value most is curiosity of mind. Obviously, honesty, empathy, patience, all those are required. But if somebody wants to learn and is curious about how this happened, what to do, what should I do, and pesters me, that is the most endearing quality. So, as you know, we are all human, we make mistakes. But in medicine, particularly, I feel that it's important to acknowledge those mistakes and learn from them. And that is where medical audit comes in, that you yourself or your team, you sit down and you say, oh, did we do this right? Did we do this wrong? And an openness there goes a long way with me. So if you make a mistake, you own the mistake and try and rectify it. So, medicine is intellectually challenging, but it also requires a certain degree of sensitivity in dealing with patients and situations, and not just with patients, also with their relatives, family, etc., who are under terrible pressure. So, doctors who can do that well, young, starting off, or even mid-career, I have a lot of respect for them. And you asked about advice. My advice to aspiring doctors is to have an open mind. You may discover exciting or fulfilling areas that you never expected. The other important thing is, which is a little unconventional, is to find exceptional mentors. I think that helps a great deal in building a career. So, some of us are fortunate to do that, others not so. They have to go the way alone. But I think that always helps. As far as the last part of your question is concerned, it's a very exciting time for medicine. So AI is becoming common in diagnostics and imaging, in drug development. Machine learning and AI algorithms are used commonly. Remote monitoring of patients, virtual reality is also becoming important. We have, when I was training, we didn't have any of these, but now there's a possibility of realistic simulation. Procedures can be practiced, surgical skills can be sharpened and practiced. If I had to learn to give an injection, I had to give an injection, right? But
Yeah.
now that's all changed. Like if I had to learn a surgical procedure, it would happen in theater. But now all that is different. Then there are other things like 3D bioprinting is important in regenerative medicine, working towards tissue organs, development of skin and organs for transplantation. Then there are the more common issues, right? People are living much longer. There are huge issues associated with an aging population, acute medical emergencies, heart attacks, strokes, etc., happen all the time. Chronic diseases are prevalent. So, not every young doctor will find the same thing interesting, but it's important to discover what your particular niche or interest is. And then, you have the passion to follow it. But despite everything else, there is one thing: doctors who combine clinical expertise with adaptability and compassion will always be in demand.
Yeah.
Amazing.
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 Thank you.
Thank you so much.
Thank
Well,
you.
thank you,
Thank you
Dr. Fatima,
both.
for
Thank you.
sharing your invaluable insights and experiences. We enjoyed this interview and this conversation very much. And to all our viewers, if you want more of this content, please make sure to leave a like and maybe even follow us. Anyways, thank you so much, Dr. Fatima.
Thank you both.
Amazing.
I'll be
Thank you.
following you.
Yeah. Thank you
Thank
so
Thank
you.
you.
much.
Bye
Bye.
bye.
Thank you.
Thanks. Bye.